All right, let's talk about knee pain because it is becoming an epidemic affecting not just older adults, but people, get this, in their 30s and 40s. Millions are expected to undergo knee replacement surgery in the coming years.
Yet, studies show that up to 1 in 3 patients are unhappy with the results of these complex procedures, leaving many searching for a better solution. And today, we are taking a closer look at a non-surgical approach that helps patients without going under the knife.
So joining us is Dr. Cogan from our sponsor, the Nerve and Disc Institute. Dr. Cogan, thank you so much for being here today.
Thanks for having me.
This is so fascinating because this used to be like you're much older before you had knee issues, but now it's a lot more common.
Exactly. Yeah. And so the last time we had you on, which was right before I went on maternity leave, we were talking about back pain, and there was other treatments for that, things that could eliminate that pain without surgery. We also know that most adults that have experienced knee pain, they are going right to surgery, but you're saying that there's another option.
Yeah, you know, it's crazy because it's a huge number, right? I read an article that said by the year 2034, 4.8 million people will require knee surgery. And that's crazy. Two reasons. One is because baby boomers are getting older. And two is we're doing such a good job of treating pain that mechanical problems get worse and worse, leading to surgery.
So we're not fixing the root.
We're not fixing the problem. We're just nursing it along, allowing it to get worse and get another shot and feel better, get another shot, and it all leads to surgery. And here's the worst part. 20 to 30% of people aren't happy with it, and a revision, and they don't last forever. So knees last 15 to 20 years. So you want to be able to at least kick it down the line as long as you can, or avoid it. Really, is what you want.
That's it. Well, talk to us about this procedure that you're working with. What's it called? How does it work?
Yeah, it's called Knee Restore RX, and basically, I started working on it after I read that article because there's not enough orthopedic surgeons in 2034 to take care of that many knees. And I figured there had to be a better way. So we took the same principles that we've been using for almost 2 decades with spine to help people avoid spine surgery and applied it to knees. And then we took the next few years just doing it on friends and families and patients until we saw what a great success rate we had, over 90%. And now we're rolling it out and teaching other people. But it's a non-surgical way to repair the mechanics of the joint, heal the joint, regenerate the tissue, and get the synovial fluid to start functioning again, so we can actually take people that were bone on bone or near bone on bone and actually get a knee joint back and have them have function, and prevent surgery is always our goal, or at least kick it down the line.
Right. And I know when you're in that pain, you're probably just like, just do whatever. Surgery seems like the quickest fix. You know, we're not patient these days.
Yeah, we're not.
But if you can actually fix the root of the problem and avoid surgery, I'm sure that's the best. Now, we heard from one of your patients who practically crawled into your office because the knee pain was so bad, but the treatment really helped. Let's watch what he said.
And he was young.
I mean, I couldn't move. My swollen, it was shot. I hobbled in, you know, kind of like, you know, jumping with 1 foot, but I couldn't move. I coach football, so last week was pretty tough. I was on my feet for doubles all week long, and I had 15 to 20,000 steps a day. So obviously at the end of the day, I'm pretty tired, my knee's sore, but wake up the next day, I'm ready to go. Without doctor's help, there's no way I could have gone through doubles.
That's got to make you feel good.
It sure does. I have the best job ever.
That's an incredible condition. So let's get to some nitty gritty. Like, which conditions really respond well to the Knee Restore RX?
So most of the patients that we see, we're told they need knee replacement because they're bone on bone or near bone on bone. So osteoarthritis, degenerative joint disease. We see people with partial tears, not complete tears because it's not magic. Even sprains and strains that are over 6 weeks old.
Okay.
So what should our viewers do to find out if you can help them?
Well, best bet is always call us. Call 586-416-DISC. That's 586-416-3472. Or you can go to our website at nervediscinstitute.com.
That's awesome, Dr. Cogan. Thank you so much for being with us.
And by the way, we're offering we're doing 50% off for your viewers. But I decided while I was in the green room, I'm going to give the first 10 callers a free treatment.
That's amazing. That's
So
amazing.
why not call? What's the hurt, you know?
Right.
The hurt is your knee
That's
right,
right.
now.
Just find out what could work for you. You never know. Thank you so
Absolutely.
much.
Thank you so
Thank
much.
you, guys.
Once again, for more information or to find the location nearest you, visit nervediscinstitute.com. You can also call 586-416-3472. And don't forget, viewers who mention Live in the D, or I'm sorry, WDIV, will get, the first 10 people will get a free treatment.
First 10 get a free treatment. All viewers for the rest of the month get 50% off on a treatment program.
That's awesome. Thank you so much again.